Welcome to my podcast. Today I'm going to talk about another interview case station for a student who's applying for School of Medicine. And the theme were about a new drug has been developed to help people lose weight, and it's currently under review by Medicine and Healthcare Product Regulatory Agency for licensing in the UK. A number of factors needs to be considered by the approved panel. So the first question asking about what's patient perspective about this new medication or new drug that it might be important for them, and you need to give your justification. The other one is about considering this drug, what two factors might the approval panel need to consider, and the other one suggests two other drug-free alternative intervention can be used to help individuals lose weight and could be better for them. So there will be a lot of candidates who answered these questions in different ways, and some they went into other different arena. So I'll just try to summarize those kind of answers, which can be covered in regard. So the first thing, any patient, whenever they want to use any drug, they want to know about the drug in great details. Say, for instance, any trial been done, they want to research more details, see people who have used it, if they have any beneficial with that, see if there's any side effect that they don't like and doesn't fit with their lifestyle or fit with their way how to intake it. Say, for instance, the dosing, if it needs to be taken multiple times a day, which can't fit with their busy schedule. Also, if there is any, for instance, clinical trial being done, and what's the major health implication, and if it's long-term or short-term implication. And they wanted to know, some they stated that they wanted to know the name of the drug in order to search for it and see if it can interact with certain drug, because some people, they might have other illnesses and they might take in other drugs, so it could be something that they need to consider. Also legality, if it's legal and approved and covered by the NSAID or the UK. Also, some they stated if it's safe and efficacy, and if it's speedy, and if it needs something to follow it up, maybe needs to monitor for certain blood tests, and if it's something that they can expect within a period of time. Some they said they will be like reluctant to try something like this, and they could consider it as a last resort. And there is the stigma and the shameful factor around taking drugs, so it's something that people they might not like to consider or let others know about it. Some they say they might be skeptical about those kind of drugs. Others they pointed about its effectiveness and its efficacy, and if it's costly, and if it's gonna how much they might lose, for instance. So some they state it might have potential benefit, and some they say it has potential risk. So they need to weigh the benefit with the risk and see how it might go with their lifestyle. Because some people, they said, some people they have stigma, they are massive obese, they might have body dysmorphia, bad self-image. All of that could have social implication, and it cause other health condition like mental health issue. And some they stated about the evidence, if it has been proven and it's been in this out for some time. And some they stated what can be done if something goes wrong, or if didn't fit with the purpose, or if they lost some weight and they couldn't keep off that loss. And some they stated they need to explore more if those patients they have other health implications like thyroid functionality, which could lead to like hypothyroidism, could lead to major weight gain. Also, some they stated it could affect their physical capability and fitness to do things, or maybe they have some eating disorder, So there were a lot of answers in regard. Somebody stated those kind of drugs need to be thoroughly looked into and shouldn't cause any harm. However, it should cause benefit if it's proven to do so by extensive research and know about this drug in great detail. And somebody stated if it's going to help and if the patient or the person have a low metabolism or have self-image problem, and not to insult when to ask those people, and kept saying they're quite massive, or maybe they have the genetic element. So there's were a lot of reasoning in regard stating those points. So for the second question, which stated basically if those approval body wanted to check for this drug, so what factors they might need to consider. Say, for instance, they wanted to see if it's efficacy with the drug already in the market. They wanted to see the evidence of benefit effect and if it's really causing positive effect on the people, and if it's going to cost the NSH, and if it's costly, so cost analysis compared to the outcome and to the other medication or treatment existing in the market. If it's going to reduce the obesity-related problem, for instance, as well, and the funding issue, maintaining the the weight loss, and the cost to the NSH, and if there is a target group that to be tested. So somebody stated it's a natural process to be considered, and it has to have ethical approval and need to have a review, and it should be tested in animals, which has similarity to human, and he stated pig. And also, some they stated about the safety and the complication efficacy. Some stated the underlying condition for the weight gain, and it should be accessible to everyone, good use of resource, and not just to waste the fund on something that might not help, and it should be beneficially, and it's not placebo, and it's not over-medication. Some stated it has to be thoroughly researched and help in the aid for the weight loss. It can help whole population, not specific certain population. So it should be target everyone who has this issue. And some stated, as I say, should be distributed equally. So it's the ethical dilemma of the justice, and it's not only financial gain and profitability. Some they stated it might need a long term for up in order to know, and if it stopped, might cause a rebound. And so on that issue, the maintaining element is missing. And some they compared it and to say it could be very expensive, it could be necessary in other arena rather than using this. So there would be some other issue that can be used. And coming back to the other question, which stating, can you suggest any other drug-free alternatives can be used as an intervention to lose weight? So basically, it's about being active, proactive, being educated, raising awareness about the implication of excessive weight gain, and probably to educate children at younger age to fight obesity at childhood, encouraging walking, marathon, gym, and gym funding. Also, talk to the social prescriber who can put you in the right place where to sign up with the gym or support group aiming to weight loss. Also by advising about the healthy diet habit, and maybe seek the dietitian to help. Some they stated about low social class and poverty, where people will just buy non-nutritious food, and because it's cheap and reduced price sometimes. So this is something to be considered, because this will help just weight gain. And maybe people that were like remote and they don't have accessibility to transport, so that's another issue. And some they stated about personal trainer. Of course, this can be costly for some people, so it's not a general thing that can be considered. Also, some they stated that patients should be have some thorough blood investigation, like thyroid function test, and see if it's an issue. So it's basically a holistic approach and view for the treatment of the patient. Some they stated about surgery, like stomach band, thought that could help, and some they were like adamant that drugs could help. Some emphasized about the physical activity, like just simple walking. However, some stated if they are massively obese, it could be having a limited mobility. So probably they spoke about GP prescribed gym membership, which can be free for some people to attend. And it's always about advocate and campaign for a healthy lifestyle plan, support group, and sit with the like-minded people in order to support each other physically and mentally, and emphasize the self-control to put down weight gain, and put a positive mindset to achieve what you want. So you need to follow it up and try to be adamant about it. Also, try to make health choice and start education at youth age in order to have a healthy mindset. Put taxes on certain foods which cause gain in the weight, like for instance sugar eating and healthy food. And encourage healthy school lunches, and ask the GP for losing options. And say some people they stated about fighting poverty and being empathetic and open about what's available, and the community program, community reach out and speak about this and best lifestyle in order to be motivated. And some advice that the government should put an advert to improve people health, making healthy choice. Some they spoke about the surgery with bariatric as a last resort if lifestyle measure drugs did not help. And with that sort of kind of thing, patients need to be as a push and motivation to themselves. Some they advocate about CBT as well as a support. And some advocated about, as I mentioned earlier on, holistic approach and putting a new policy, like in the school, by improving movement, improving physicality, and support club in order to be active always. And try to avoid driving. If you are driving, just try to walk, and try to start with small things which can make a lot difference. Some advocated about specialist clinic which can help as well, or maybe friends and family to motivate and set targets. And has an open discussion about healthy lifestyle, try to support each other and encourage. Some they spoke about the socio-economic background reasoning, like shortage of money and current lifestyle and the living situation, which can cause a lot of stress. And people who are low in income, they will just buy the cheap food, and this will lead to childhood obesity, and they wouldn't be able to make the right nutritional choice. Or maybe they were like in far location, or someone stated about the food bank which is provided to the people short of money. All that she said, it's all not healthy choice, and it's all just junk food. So it's not a good choice for those people, and it will just cause issue. So it's, and some they spoke about tailoring and personalization to the plan for each person in order to save money and make a better choice and eating habit. And also, it's about some choices of the gym whereby they offer like a few months free membership to GCP or the social prescriber. And some they spoke about workshop environment to support fitness and diet and good quality of food, and calculating the calorie as well, and the calorie deficient food. So all of that counts in that measure. So just needs to give certain points and just justify why do you think this is the best choice for that kind of question. Thank you.